RemunityPRO pump for Remodulin treprostinil injection. Indication: the RemunityPRO pump for Remodulin treprostinil injection is intended for continuous subcutaneous delivery of Remodulin treprostinil injection for use in patients ages 17 and older. Important safety information for RemunityPRO. Warnings and cautions. Do not use the system outside the conditions listed in the user guide. Retain the user guide for future reference. Refer to the user guide for all warnings and cautions. Failure to comply with the following warnings and cautions may result in harm. Limited to use with Remodulin. Only RemunityPRO cassettes may be used with the RemunityPRO pump. RemunityPRO pump is for use only with FDA-cleared infusion sets. Medtronic QuickSet Infusion Set, MMT-392, MMT-393, Naria Guard, 704060-5229, 704060-5226, Medtronic Silhouette Infusion Set, MMT-373, and Smith's Medical Clio 90 Infusion Set, 21-7230-24, 21-7220-24. Do not use disposables from previously opened or damaged sterile packaging, damaged disposable components, or expired sterile components. If the pump or remote fail to work as detailed in the user guide, stop using the pump and remote and switch to the alternate pump and remote included with your system. Only use the supplied cables with your RemunityPRO system, as other cables could interfere with pump function. Disconnect the infusion set tubing from your infusion site before removing the cassette from the pump. Avoid exposure of your pump and cassette to temperatures below 41 degrees Fahrenheit, 5 degrees Celsius, or above 104 degrees Fahrenheit, 40 degrees Celsius. The pump may affect nearby electrical and electronic devices, including medical devices, cell phones, Bluetooth devices, RFID readers, Wi-Fi equipment, and strong magnetic fields, causing these devices to operate abnormally or to stop functioning. Keep the pump, remote, and battery charger at least 12 inches, 30 centimeters, away from electrical, medical, and wireless devices. Do not open, crush, heat above 140 degrees Fahrenheit, 60 degrees Celsius, or incinerate the pump battery or remote, as doing so can lead to fire, burns, and property damage. This system supports flow rates between 8 microliters per hour and 225 microliters per hour. If the required flow rate is outside this range, discuss with your specialty pharmacy or healthcare provider. Prescription information. Caution: federal law USA restricts this device to sale by or on the order of a licensed healthcare provider. Use of this device without the training and supervision of a healthcare provider may lead to errors that result in harm. See the RemunityPRO pump for Remodulin treprostinil injection user guide for further detailed important safety information, including warnings, cautions, and instructions on how to properly use the system. For further information, please call United Therapeutics Corp. at 1-844-864-8437. The RemunityPRO pump for Remodulin treprostinil injection is manufactured for United Therapeutics Corporation. Remodulin treprostinil injection. Indication: Remodulin is a prostacyclin vasodilator indicated for the treatment of pulmonary arterial hypertension, PAH, WHO Group 1, to diminish symptoms associated with exercise. Studies establishing effectiveness included patients with NYHA functional class 2 through 4 symptoms and etiologies of idiopathic or heritable PAH, 58%, PAH associated with congenital systemic to pulmonary shunts, 23%, or PAH associated with connective tissue diseases, 19%. In patients with PAH requiring transition from epoprostenol, Remodulin is indicated to diminish the rate of clinical deterioration. Consider the risks and benefits of each drug prior to transition. Important safety information for Remodulin. Warnings and precautions. Chronic intravenous IV infusions of Remodulin delivered using an external infusion pump with an indwelling central venous catheter are associated with the risk of bloodstream infections, BSIs, and sepsis, which may be fatal. Therefore, continuous subcutaneous SC infusion is the preferred mode of administration. Avoid abrupt withdrawal or sudden large reductions in dosage of Remodulin, which may result in worsening of PAH symptoms. Titrate slowly in patients with hepatic insufficiency, because such patients will likely be exposed to greater systemic concentrations relative to patients with normal hepatic function. Remodulin is a pulmonary and systemic vasodilator. In patients with low systemic arterial pressure, treatment with Remodulin may produce symptomatic hypotension. Remodulin inhibits platelet aggregation and increases the risk of bleeding. Adverse reactions. In clinical studies of SC Remodulin infusion, the most common adverse events reported were infusion site pain and infusion site reaction, redness, swelling, and rash. These symptoms were sometimes severe and sometimes required treatment with narcotics or discontinuation of Remodulin. The IV infusion of Remodulin with an external infusion pump has been associated with a risk of bloodstream infections, arm swelling, paresthesias, hematoma, and pain. Other common adverse events, greater than or equal to 3% more than placebo, seen with either SC or IV Remodulin were headache, 27% versus 23%, diarrhea, 25% versus 16%, nausea, 22% versus 18%, rash, 14% versus 11%, jaw pain, 13% versus 5%, vasodilatation, 11% versus 5%, edema, 9% versus 3%, and hypotension, 4% versus 2%. Drug interactions. Remodulin dosage adjustment may be necessary if inhibitors or inducers of CYP2C8 are added or withdrawn. Specific populations. In patients with mild or moderate hepatic insufficiency, decrease the initial dose of Remodulin to 0.625 nanograms per kilogram per minute of ideal body weight and monitor closely. Remodulin has not been studied in patients with severe hepatic insufficiency. Safety and effectiveness of Remodulin in pediatric patients have not been established. It is unknown if geriatric patients respond differently than younger patients. Caution should be used when selecting a dose for geriatric patients. There are no adequate and well-controlled studies with Remodulin in pregnant women. It is not known whether treprostinil is excreted in human milk or if it affects the breastfed infant or milk production. Please see accompanying full prescribing information for Remodulin. For additional information, visit www.RemunityPRO.com or call customer service at 1-844-UNITHER, 1-844-864-8437.